my name is Jada Wooten, and for my disease, my group did syphilis, and specifically, I did it on the treatments. So first off, the first slide is what is syphilis. And basically, syphilis is a sexually transmitted infection caused by the bacteria, I don't know how to say that, Treponema pallidum, which can continue to progress if left untreated. It can lead to serious long-term damage to the heart, brain, and other organs, but can be cured easily in early stages with the right treatments. Syphilis progresses through primary, secondary, latent, and tertiary stages. So these are the different stages when it comes to the occurrence of syphilis. Now this slide is the first line of treatment, which is mainly about which is mainly about penicillin being the #1 treatment when it comes to syphilis. And that's a chart. Penicillin is the first line treatment for syphilis because it is the most effective medication for killing the disease at every stage of the infection. It works and acts quickly, has a long track record of success with syphilis, and significantly reduces the risk of long-term complications. Penicillin is recommended over all antibiotics when it comes to treatment because they are usually less reliable and may not work as well for certain stages, or even more specifically in pregnant women. Penicillin is also the only proven treatment that prevents collagen syphilis during pregnancy. So we're gonna more so get into the side effects when it comes to pregnancy with it, but again, a chart comparing and seeing how penicillin is more likely to have success rate versus another treatment for syphilis. This slide is different alternative treatments if not penicillin. So first one, these names are a little hard to read. Dioxycycline, which is an oral, so taken by mouth, an oral antibiotic used when someone is allergic to penicillin. It works well for early stages of syphilis, but may be taken every day for several weeks. But must be taken every day for several weeks. Now that one, Certeron, I don't know how to say it, but it's an injection antibiotic that can treat syphilis when penicillin isn't an option. It is usually given for several days and works best for early stages of syphilis. And then this last one, is a single dose oral antibiotic, which can be sometimes used in rare cases. So this one specifically, this last one, it isn't as common as an antibiotic when it comes to syphilis as penicillin and the other ones along the line. Okay, a single dose oral antibiotic, which can be sometimes used in rare cases, but is usually not preferred because resistance does start increasing, which basically means with this specific treatment, as time goes by, at some point the bacteria are gonna no longer be affected by the treatment. So therefore the antibiotic will learn how to basically fight it off or not be affected by it and still continue to grow. So, right, again, which means the bacteria is no longer much affected by the antibiotic. It is only considered when no other options are safe. So this is out of all the options, penicillin and these two, this is one of the last treatments for it. Okay, so this slide is basically going into detail of how each of the specific treatments work. So starting at penicillin. Penicillin works by breaking down the bacteria's cell wall, which causes the syphilis-causing organism to die. It stays in the body long enough, which acts quickly and is highly effective at all stages of syphilis. The most effective antibiotic when coming to treating syphilis is penicillin because of the fact that at all stages during syphilis, penicillin could stop the bacteria from growing. Dioxycycline works by blocking the bacteria's ability to make proteins, which stops the bacteria from growing and spreading over time. It helps the body clear infection. And the next one, the one with the C, it starts by interfering with the bacteria's ability to build its cell wall, causing syphilis bacteria to weaken and die. And then the last one, which was one of the least effective ones, which is it works by blocking the bacteria's ability to make proteins it needs to survive by stopping and stopping the growing of the bacteria over time. That's for that side. Now we're gonna get to specifically when it comes to being pregnant and having syphilis and what that could do to your baby and like the pregnancy terms in general, like the effects it can have with it. So pregnancy and congenital syphilis. So basically, syphilis during pregnancy can seriously harm a developing baby during the stages of it. It can lead to things such as miscarriage, premature birth, or even a stillborn, which is when a baby is born dead, if not being treated. So basically, a mother can like pass syphilis down when it comes to like when a pregnant woman is when they have syphilis, it is possible they could pass it down to the baby. So it's best to get treatment as early as possible. Penicillin is the only proven treatment that prevents congenital syphilis during pregnancy. So therefore, again, like one of the reasons why penicillin is like such a trusted source for when it comes to treating syphilis, because like it's the most safest one, but also like the one that's more reliable, like in almost any case. Like again, with pregnant women, it's safe. Penicillin is the only proven treatment that prevents congenital syphilis during pregnancy, which is when the infection of syphilis is passed down again to the baby from the pregnant woman. It can cause several problems like low birth weight, like as far as when it comes to like the baby, you know, like chances of surviving. It can cause things such as low birth weight, organ damage, or even bone deformities. So like even like the chances of your baby being born, like there's still like things that could happen like after birth. Like if your baby makes it after birth, there are like side effects that can like really like mess your baby's life up. And again, a chart showing, and I'll read that too. It says congenital syphilis, reported cases by years of birth rates. Reported cases of primary and secondary syphilis among women ages 15 to 45, United States from 2013 to 2022. And we can see that, okay. So this is different side effects or reactions when it comes to syphilis and the treatments, or not syphilis, but like the side effects that comes with the treatments of it. Common treatment side effects when it comes to syphilis would include things such as mild fevers, headache, and soreness at the injection site. These symptoms are usually temporary and they like usually go away like on their own eventually. Like these are very like mild, you know, that they can go away. Okay, in this part, the jars hem, I don't know how to say it, but this right here specifically, it says is a reaction in a short term response that can cause fevers, chills, and muscle aches within 24 hours after treatments begin. This happens because the body is reacting to the dying bacteria and it typically resolves it quickly. So obviously, because it's something that your body isn't like first used to, it's gonna like react that way, but once it processes it, everything obviously is like fine. And again, another chart. Next slide. Okay, this is our treatment follow-up. So like times that are like best to do treatments and to do checkups, because they are important and like they are mandatory to do for patients that have it. So these are follow-up blood tests are done at 6, 12, and sometimes even the 12-month mark to make sure that treatments worked and the infection levels are dropping as expected. So it's always best, again, for like if you do have syphilis, it's important and it's always required to get checked in and like spread it out between months. This helps doctors confirm that the bacteria are fully gone. So as the time goes, it's like showing the progress of the treatments for syphilis to see if they're really working over time. Follow-up visits are also checked for reinfection, which meaning like syphilis coming back. Since someone could get syphilis again even after being cured, monitoring helps catches any new infections early before it causes damage. So again, it's best because if you do have it, you can get it again. So again, it's always best to get syphilis treated early on before it gets too far. Okay. And these are causes of treatment's failure. So basically, there's like different reasons on why like treatment couldn't be or not really work, but like things that could interrupt it from like working and continuing to work and like get rid of like the bacteria over time. So missed or incomplete can lead to treatment failure because the bacteria are not fully killed and may continue to spread in the body, meaning like Mr. Incomplete, like treatment days to go in. Completing the full treatment plan. Completing the full treatment plan is essential. Reinfections from an untreated sexual partner is also a common cause. So if you do have it, and if you do sexual active with another partner who does have it, you can catch it again. A common cause since being cured once does not provide immunity. Partners must be tested and treated to prevent the infections from returning. Certain medical conditions like HIV infections could affect how well the body responds to treatment, making follow-up testing very important. Late-stage syphilis can also be harder to treat fully. So things like other diseases can also get in the way and affect that from the treatment from working fully as it should. Syphilis cases over time. Okay, so this is a kind of an increased chart I have right here, a graph. It says in 2024 to 2025, congenital syphilis, which again is when a lady is pregnant and has syphilis and could possibly pass it down to her kid. Congenital syphilis is when the infection is being passed down again from the mother to the newborn. This has continued to rise with nearly 4,000 newborn cases reported in 2024. That number reflects nearly 700% increase since 2015, showing the infection remains a serious and growing public health concern for infants. And this is just when it comes to congenital syphilis. Right here where it says syphilis cases have increased dramatically over the last decade. Between 2018 and 2022, reported cases rose by almost 80% nationwide, making levels not seen since the 1950s. So as we can see, over time there was an increase when it came to cases of syphilis. And right here is our last slide, which is our different sources for our credit. Okay, thank you for watching. Bye.